This week in the pandemic, I'm going to review about 3 articles that just came out and talk a little bit about the politics of the pandemic. First is in New England Journal of Medicine, July 28th, the mRNA 1273 candidate vaccine was tested on non-human primates, monkeys. Good news is the monkeys did very well. They were not harmed by the vaccine, and they did produce neutralizing antibodies. Good thing happening there. Now that vaccine is going on to human trials, large human trials with 30,000 participants, and will be all over the United States. There are other vaccines under investigation across the world. In fact, there's over 200 candidate vaccines right now. So they keep coming along. They look like they can be safe. They can be effective. We don't know how long they'll be effective. That's really a big question. July 19th in JAMA, the Journal of the American Medical Association. This one looked at symptoms after having COVID-19 and being hospitalized with it. For most of these people, they did have signs of pneumonia, 73% of them, and 2 months later, they polled them to find out what kind of symptoms they had. So 2 months later, 87% of all the participants in this study still had some pretty significant symptoms. Most of them were vague, but still there. 53% fatigue, 43% shortness of breath, 27% joint pain, chest pain, on and on. So 2 months later, this virus, especially when you get it in your lungs, will really put you on your back for a while. And symptoms, a lot of these people, 87%, still had symptoms 2 months later. Let's go to August 6th, New England Journal of Medicine. Again, hydroxychloroquine. This is post-exposure prophylaxis for COVID-19. So this is one, it was actually a mail-in. People self-reported that they had a significant exposure to COVID-19, so they hadn't gotten it yet. So they had an exposure to somebody, and they enrolled in the study, and the people doing the study sent them either a placebo or hydroxychloroquine. So there's over 800 people, and they saw that in the placebo group and the hydroxychloroquine group, there was really no difference in the number who went on to get COVID-19 infection. There were limitations to that study, but it still didn't show any great effect. You know, when people are touting this as a cure, or we don't need to do social isolation, we don't need to wear masks, we don't need to do all this because we have the cure, hydroxychloroquine, these studies just don't show that. Now, the jury is still out. Does it have an effect? When we talk about having an effect, though, we're talking about a modest effect. This is not going to be a huge game-changing effect as President Trump. So how did politics affect the pandemic? Well, Trump is a Trumpist and Cuomo is a quack. So if you are against Trump, you would say he's a Trumpist. He's all about himself. He does everything for himself and is quite the narcissist. If you are against the Democrat or Cuomo, you'd say Cuomo's a quack because he's been trying to tell everybody what to do. He had that nursing home debacle. So a lot of times our biases go into what we think about the politics and the pandemic. But I'm going to try to be unbiased. I do have a political bias, and I'll share that with you at the end. But first, I think I can look at these as a medical doctor and kind of give my opinion about how it's affected medically. As I've already talked about, Trump and his talking about hydroxychloroquine had a negative effect. It's brought a topic to open debate amongst people in Facebook and other places and getting people mad at each other that really should have never been. Things like hydroxychloroquine and its effectiveness on a new virus are usually debated amongst academics, scientists, and doctors. Well, one, the division that people have felt and the back and forth that people have felt over this topic has been pretty tough. It's made us a little more divided. It's also affected the number of studies. Right now, there's over 200 studies looking at hydroxychloroquine and its effect in COVID-19. It's really too many studies. To look at this, we do need studies, but the attention that's been brought to it and the number of studies and the resources that are going towards that, towards something that the most is going to have a modest effect or no effect, I think it's too much. Start by saying that our elected officials are supposed to give us guidance during the pandemic. If it were wartime, they would give us guidance. They'd listen to the general. During a pandemic, they give us guidance. They are the spokesperson, and they listen to their medical people. I think for both sides, they should listen to their doctors and medical people and experts more. I think Cuomo has been informed by science and been informed by medical people, and he's given that a good been a good spokesperson for that. But I don't think he's allowed them to have the podium where they could actually talk and explain some of the things that he can't explain as well. Trump has said some very inconsistent things. From the very beginning, he said he wasn't going to wear a mask, and it wasn't a good message for our country. And we did find that we had surges in June of cases across the Midwest, the South, and the West. And you could say that a lack of a federal policy may have had an effect on it. It very well could have. He's said some very inconsistent things. He's talked about the whole virus and the whole pandemic being a Democratic hoax. Actual quote. So he's actually breeding the grounds for conspiracy theories with this being a quote hoax at one point. So he has been unclear. At the beginning, he did minimize the pandemic. I think he was trying to be hopeful for people, to be fair to him, but it wasn't a good and it wasn't a realistic hope to say this is just going to go away. So it was an unrealistic attempt at trying to reassure people, and it had the opposite effect. He hasn't been following his expert opinions. How many times has he contradicted Dr. Fauci? Deborah Birx and Anthony Fauci have had very reasonable and good voices for this pandemic. He should really put them up front more often, if not all the time. They're both very good. And listen to them. Every time you can, listen to Deborah Birx and Dr. Anthony Fauci and what they've said about this pandemic. They have good things to say. How about Cuomo and the nursing home problem? You have to remember, and those of you who don't live in New York may not have felt this as much as we did. In March and in April, when the numbers were ramping up so high in New York City, we were getting ready for a surge of patients to come upstate just from the infection moving, but also we were getting ready for a possible overflow of patients being transported from New York City to upstate hospitals. So I was actually getting ready to go into the hospital. I did some retraining to go back in the hospital and getting ready for their system and computers, and was ready to take care of hospitalized patients. I thought they might come from New York City. At that time, as the hospitals were filling, something had to happen to make more room. One of those accommodations was to say you can't bar people with COVID-19 who have gotten better from going back to their nursing homes. That's really what the New York State mandate said. They retracted it in May when there were so much spread through the nursing homes, and the nursing homes were decimated. Now, was it just because of hospitalized patients coming? No. It was because they got infections through other ways. So you have to put this in perspective. Don't just say Cuomo did it wrong because he sent patients back to the nursing home. Understand the context of what was going on there. On Trump's side, understand that some of the things he's not said clearly, he's allowed the governors and individual states to do. Have a little latitude there. That's probably the right thing to do, and he said that. We're going to allow the 50 states to do their own thing, and you really have to. Wyoming shouldn't have as many restrictions at some point as New York City and New York State did. They just didn't have as many infections. So there is differences in states, and he tried to allow that. So one of the things we need to do as a country is to have a little more tolerance for each other. Even this hydroxychloroquine problem and talking about it, it really divided people. I'm a big fan of Brian Stevenson. He wrote the book Just Mercy, and you might have seen the movie also. He has spent his life trying to free wrongly convicted people on death row, and he's worked in trying to heal the justice system in the United States that has been unfairly against people of color. But he says in his book, and there's a wonderful part of the book, and so much better than the movie, that we all have brokenness. When we see somebody in need, like somebody who's in the prison system, and we see their brokenness, we also understand our own brokenness. We are all flawed. When we came into this pandemic, there was no way that any of us were going to handle it perfectly. We were going to learn. We were going to make mistakes. So when we realize our own brokenness, it allows us to have more mercy towards other people who are broken. And that's Brian Stevenson's point. In a pandemic, when we understand that we're trying to do the best we can, they're trying to do the best they can, I'm not perfect, I can have a little more mercy for those who are trying. And I think it's really what we should be doing right now, is working more together, not getting mad at each other. So one of the things that should be avoided are things like conspiracy theories that are just way out there. What do you have to believe a conspiracy theory about somebody else in your own country? You have to believe that some segment of your culture is out to destroy you, to purposely and maliciously destroy you. You also have to believe that those who are following that side, so if it's the other side that the conspiracy theory is about, all those that are following them are complicit to it. So if you think that maybe I'm saying that hydroxychloroquine is not effective because I'm looking at studies, and you think that's a conspiracy theory, one, you've got to think that somebody is maliciously covering this up and trying to harm you. Two, you have to believe that I'm complicit in it and that I'm causing harm also. It's just a dangerous way of thinking, to think that everybody else is either evil and I'm good. When we understand that we all have need of help. I'm broken. I can't do this pandemic alone. I need other people's help. You need other people's help. Let's just help each other. Be patient for the science. Be patient with doctors and people who are trying to figure out how to do this best. Understand that we're going to learn. When we send kids back to school, we're going to learn. There's going to be some mistakes, but we're trying to do the best thing right now. Last thing, I told you I would tell you my political bias. I think I can look at some of these things and give an unbiased approach, but here's my bias. Have a great week.